Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Nahmaduhu wa nusalli ala rasulihil kareem. I hope all of you are fine. Today is the second talk for our series Womb to Heart on this channel. Last time we discussed about the introduction and few terms were defined, and it was discussed that mom to be is the focus of prenatal or antenatal care. Today we will have certain more details, but let's define the pregnancy first. Duration of pregnancy is counted from the first day of your last menses, and it is 9 months and 7 days by Gregorian year and 9 months and 14 days by lunar year. So this is expected date of delivery. All women are not supposed to be delivered on the same date. Majority of the women delivered either a week earlier or a week after the expected date of delivery. By weeks it is 40 complete weeks, and by days it is 280 days. Why 40 weeks? Because 4 weeks of pregnancy are counted as 28 days and not as 30 or 31 days. When you are complete 40 weeks and after that you are considered as postdates, and when duration of your pregnancy is 42 weeks, then it will be called as postterm. So information is conveyed to you at different occasions during pregnancy. The first time is when you have the first contact with a healthcare professional, and there are certain informations that are conveyed to you, including folic acid supplementation and its importance. Second information is about food hygiene and how you can reduce the risk of a food acquired infection. Third thing is related to the lifestyle advice. There are certain number of women who are smoking or are using recreational drugs, so those women should be informed about the effect of these habits on pregnancy and effect of pregnancy on these habits. The next thing is the information about all antenatal screening, including screening for hemoglobinopathies, the anomaly scan, and the screening for Down syndrome, including the risks and benefits of the screening tests. Anomaly scan is a detailed ultrasound that is done between 18 to 22 weeks to know the details of the fetus and its growth and to exclude certain abnormalities of the fetus. The next time to convey the information to you is at your booking visit. That should ideally be by 10 weeks. At this visit, you will get information about the development of your baby during pregnancy, impact of nutrition and diet, including vitamin D supplementation for those women especially who are at risk of vitamin D deficiency, about exercise and the effect of exercise on pregnancy, including pelvic floor exercises. Then you will be aware about the place of birth. You will be informed about pregnancy care pathway. There are different pregnancy care pathway in different hospitals and in different healthcare systems, and you must know about the pregnancy care pathway where you are going to be delivered. You will be informed about breastfeeding, including the availability of workshops. You are lucky if you have workshop where you are going to be delivered, but if you don't have this facility, then you can use the other workshops, or you can take the help of internet. Then antenatal classes, if you have in your healthcare setting or no, and further details about the screening tests and discussion of mental health issues, because mental health issues are quite important during pregnancy. The next time when you will get information is before or at 36 weeks, and this information will be related to breastfeeding, including the techniques and best practices for breastfeeding, preparation for labor and birth, and it will include the options for your pain control during labor. Then how will you recognize that are you in active labor or not? Then how will you take care of the new baby? Vitamin K prophylaxis for your baby. And when your baby will be born, there will be certain screening tests that will be done, and you must be aware about those screening tests. Then how will you take care of yourself after the delivery? After delivery, some number of women may have baby blues or postnatal depression. So you must be aware about these things, so you can recognize if unluckily you are the one who is suffering from these conditions. At 38 weeks of pregnancy, you must be discussed about the management of prolonged pregnancy. For example, if your pregnancy is exceeding beyond your expected date of delivery, it means 40 weeks or after 41 weeks or 42 weeks. This information should be given in a very simple way, so all the moms to be can understand this information. And nowadays the help of audiovisual aids can be taken. One thing that is very important for the healthcare practitioner who are providing information to the women who are on family way is that all the information should be up to date, it should be evidence based, and it should be in such a way so that women can take informed decision about her condition. At each antenatal appointment, healthcare professional should offer this consistent information and clear explanations. And women should have an opportunity to discuss the issues and should have an opportunity to ask the questions. When any laboratory test is done, it should be explained to the women that what is the purpose of that test. And women have all the right to accept or reject the test, and it should be clearly documented. If you are going to be a mom first time and your pregnancy is smooth and there is no associated problem, then there are scheduled 10 appointments minimum. And if you have a baby before and your pregnancy is smooth and you don't have any complication of pregnancy or any associated abnormality or disease, so then the scheduled visits will be 7 minimum. And for healthcare professional who is providing the care to the women, it is important that early in pregnancy, all women should receive appropriate written information. A second thing that is important for the healthcare professional is that all appointments should be structured and they should have a focused content. So this is the information that is, I think, enough for today. And next time we will discuss further details about pregnancy. It's my pleasure to answer your questions, so kindly put forward if you have any question. I hope we will see each other and we can listen each other next time. Take care.